Hey, Den family. This is Den Mother Amanda coming back live again, and I want to get on kind of a touchy subject about children and specifically transgender children, and kind of did some research, a little bit of research on some of this stuff, or well, quite a lot actually. And I'm still trying to figure out how to bring stuff up to put it into be able to be viewed for what I've found. I haven't figured that out yet, but as soon as I figure out how to do that, I will start doing that. And if transgender children is, if there is such a thing, or might it be something else? And if children are can be trans, what's the average amount of children that might be identifying as transgender and continue to identify as that or be that into adulthood? And some of the medical drawbacks of medicalizing children with puberty blockers and cross-sex hormones just as puberty starts, or sure, just before, just after puberty starts. I know there's a big debate on that topic, and sometimes it seems like nobody wants to sit down and just have a discussion, honest and open discussion about the effects of medications on the gender conforming or transgender medical procedures for children, such as things like Lubron and other puberty blocking medications, and for boys and girls getting double mastectomies at a very, very young age. Uh, is it damaging them? Is it really a pause? And what are some of the consequences that might be positive or may not be, that are probable, that are negative? Some of this research comes from that I've done looking into is from detransitioners that started as a child and detransitioned as an adult or later on in their teens, and some of the side effects that they've had from, or lack of side effects that they've had from puberty blockers and cross-sex hormones. I think there's a lot of room to come at this topic with a lot of care and compassion, um, and see which one outweighs the other. Um, I have some, strong opinions about it from the research that I have done. I try to combat at it with a compassion for the health and welfare of children, and what these medications do or don't do, harm or don't harm. And of course, there's always going to be some kind of side effects to some degree with any medication. And whether you're an adult or a child, and we already know some aren't, like some antibiotics that for helping deal with like something like pneumonia or infections and stuff like that. That unless somebody's actually allergic to those antibiotics, that are probably more positive than negative. Um, and we'll go over some of what puberty blockers are used for when it comes to children and adults, and why it's being used for certain groups of people, whether it be adults or children. could be an interesting topic. And please, really seriously stay for the whole thing. If you have ideas, comments that are positive, either for or against having minor children go through medical treatment with puberty blockers, cross sex hormones, and things like double mastectomies as minor children, and SRS, sex reassignment or gender reassignment surgery. And some of it's heartbreaking. So I did take a lot of notes. So I would try to keep it as comprehensive as possible and try to come at it from an angle where I'm not going to be, hopefully, not going to be too harsh about my beliefs when it comes to medicalization of children who believe or strongly think that they're transgender, and whether there is such a thing. Um, we're also going to talk about sanctuary states and non-sanctuary states for children who believe they're trans and transgender and want to go through medical treatment. And majority of states are not sanctuary states for trans children. I only think there's like 3, so we will go over those anyway. And trans kid moving, when it comes to that moving for states, certain states such as Connecticut and Massachusetts and California, and they claim it's to keep their children safe. Okay, and keeping them safe, that could mean a few different things, at least a couple of different things anyway. They could consider it, maybe, and I don't agree with this, and I think parents are getting scared by the medical community, whether it be therapists, psychologists, psychiatrists, or just doctors, claiming that if they don't start transitioning children, they'll commit suicide, and the numbers do seem to be elevated for that. And I'll go into what I think could be some possible alternatives to medication for transgender children. Some that probably I don't consider should be used, and some that can be. And the most important thing is the children's mental health and well-being, and that's where we all should come from. And I believe that most all parents do. There are some that just say their kids are trans, and children say that they're not. That's different. That's for a different video. Yeah. I put down in some of my notes. If you want to keep children safe, don't medically transition your kids. And I'll go into why. Some of it's because of the medication and the ideology that it's actually 100% safe, and it's only a pause. Once they're taken off puberty, will start up again. One of the popular prescriptions for puberty blockers for children is Lupron. Okay. And what Lupron is originally used for is prepubescent children, or children at the age of are considered legitimately to still be prepubescent before puberty starts at a certain age. And it's been getting a bit younger over the decades. Still, it's been given to children so that puberty doesn't start too soon. Okay, there's a lot of discomfort for children in schools with that, with those starting puberty too soon. I remember going in school. There were a few of us kids in schools, minor children, that started puberty earlier, and there was a discomfort. And some of it's noticeable. You know, with girls be in breast development or at an early age, boys with facial hair starting to come in at an earlier age, and all that stuff that can be uncomfortable for minor children. With most children at a certain age that aren't going through that, starting to go through that yet, with teasing and bullying and things like that. Those are the things we should watch out for and help our children with, to understand what they're going through, and help them cope with whatever may be going on because of the changes that come with that. As we all know, puberty is a difficult stage, whether we're born male or born female. It's a difficult time for us to actually understand what's going on with our bodies and maturing and our brain development, and it's awkward. It really is at times. It's really awkward. I think some of the things that we can do is help children find something that they can do that they enjoy doing, and as an added side distraction, to help out their insecurities about it, like sports in school, after school things that they can do in school, that the schools offer for after school projects and stuff to do. Um, Maskers or acting or things like language clubs and other clubs that are offered in like middle school and high school, junior high and high school. Things like that, where they're getting in contact with people that they can get along with because they have things in common that they like and enjoy doing, and help ease some of that discomfort that they have about going through puberty a little bit earlier than normal. Um, Listen, kids are important, and their mental well-being and physical well-being are important. Um, and putting doing it as just an extremely temporary pause, and maybe 3, maybe 4 months at most. Because some of the side effects are, and to get into what like Lupron is used for okay, we're gonna go start with adults and sometimes children when it comes to other than medical use for transgender children. Some of the medical uses are it's used for like prostate cancer. I think also breast cancer and some other cancers and stuff like and colon cancer and stuff like things like that. Other cancers that kind of affect the reproductive systems, um, our urinary systems, to help treat that and hopefully get past this so they don't have it anymore. Because the medical technology is come a long way when it comes to cancer research and dealing with cancer in adults and children. Uh, um, Also, Lupron has been used for adult convicted adult sexual predators and child molesters. And what it does for them is it completely stops their sex drive, shuts off their reproductive system permanent, and it takes some time to completely shut it off with that. It's also been called by doctors and others a chemical castration, in which it is. And in my belief, if people are doing that, going to like doctors to help get that stuff. I know one doctor that does treat that at one time was treating at least two who have been convicted sex offenders that had come in and asked, "Hey, I can't stop that desire. Can you help me out?" And the doctor said, "Well, I don't agree with what they did, but I will help them out so they don't harm any children anymore." And that's being responsible and being helpful to children so they're not harmed way anymore. And I'm totally for that. And if somebody's been convicted of a sex crime, really convicted of a sex crime, and that's getting better to be able to do accurately, should be put on a mandatory. It should be mandatory to have them put on it after the first one, after the first conviction. Okay, because of the stigma that comes along with it. And there is a stigma that comes along with it. We want to make sure that we're doing the right thing for the child, big time for the child, because we want our children to be safe, children and grandchildren, and our brothers and sisters that are children to be safe, and adults to be safe as well from sexual predators. I believe they should be put on Lupron and the like, kind of in this very similar. Um, for lack of a better word, when it comes to treating adults, like puberty blockers and stuff like hormone blockers. Hormone blockers, that's what it's looking for, is hormone blockers for adults to do that stuff to people. Because it's just, it is disgusting. And there are some and this is going to be kind of controversial. I think some do have a conscience about it, but just can't control it. If they're doing something medically to be able to stop that, so they don't harm children anymore, that's a plus. If they're doing it on their own, so they don't harm children and other people, adults, I think that part of it is a good thing. So they don't do it anymore. What they did, no, it's not good. If they're willing to take measures and steps to make sure that they don't do it again, that's definitely a plus. People will be safer. And yeah, so uh, anyway, like I say, it stops the reproductive system. It shuts off the pituitary gland. Um, it stops the ovary, stops ovulation, and it stops semen production. Okay, for that stuff to come back, to be turned back on and come back and start up again, it has to be extremely short term. The longer the person is on it, the more damage it does to a person. To where eventually puberty is just completely stopped, and no more development will happen in children. And children need to go through certain stages in puberty to be able to get the development that they need. The mental and emotional development and the physical development. Um, Now, trans kids are there really are kids are there children that are really transsexual, transgender? I believe that there are some, but it's very few. And I've seen some studies, and some other people have talked about studies, dual studies, controlled studies, and the controlled studies they're talking about is two sets of patients. One set of two patients being treated with puberty blockers, and one set not. And a lot of these studies have come from like Switzerland, Denmark, Norway, Germany, and I think a few others. And once they started puberty blockers, they continue to transition. And then eventually, most of them realize, hey, I'm really not transgender or transsexual. This was the wrong thing for me to do, and I can't go back. There's a whole lot of detransitioners out there. Then it's usually most of them the detransitioners that I've found are the female to male detransitioners. There's a couple of others. I've seen a few that are male to female detransitioners. I think the majority is female to male that are detransitioning. They eventually find out it wasn't right for them, and they suffered a lot of medical consequences that they can't come back from. And one of those is the loss of reproduction, being the ability to reproduce children, and it doesn't come back. It's 100%. And for those that are on short term, I think there's one I know of one that was on it for short term that started in the late teens. Um, that's not sure. I think short term was like I think less somewhere in the ballpark of a little less than a year. Also, this person also had a double mastectomy, and breasts don't grow back. They just don't grow back. If this person can and does have children, we'll never be able to breastfeed her children, and that's sad. It really is, and for those who are on long term, like I said, they lose all reproductive ability because they weren't able to go through the proper stages of puberty when when it was the time when it was time for them to do that, and then put on cross sex hormones, and it's just sad. It is. It's heart wrenching and heartbreaking, and we're seeing more and more of the detransitioners coming out. Uh, yeah, it's one of those things that maybe something else should be done instead of medically treating children for gender dysphoria. Because gender dysphoria could mean different things for different people. Okay, and the control part of the studies were that the people that were put on puberty blockers, 80% were either LGB or non-binary. I don't agree with queer, but queer, and people are trying to retake that word to mean something different than what it originally meant, which is cool. Uh, or they were just straight. I don't know, and people going through puberty, it I don't want to say this. it worked its way out, and they found out by going through puberty that okay, it was confused about my gender and sexuality. Okay, so they say some are gonna be lesbian, some gonna be gay, some bisexual, some non-binary, some queer, some straight. Like 80%. That's a high, extremely high number, an extremely high percentage. Um, and knowing this information, I think there's other ways to be able to help children get through that stage, um, the stages of puberty, in a caring, loving, and compassionate way. So, like I said before, get them involved with sports and children that like have the same interests as they do, and let them explore their gender. Uh, um, see what it is for them, and some of most of them will end up not being transgender, transsexual, and there are some that will end up being transsexual or transgender. How do we really know unless we let them develop the way they were born, go through the puberty they were born as? Okay, and some of the other things that can be done to help these children out, and us gets get them involved with support groups. For children that are gender questioning and trying to figure it out. Um, so I remember as a child questioning, what's going on with me? Why do I feel the way I feel? Do I really believe I should have been born a girl? Am I gay? Am I bisexual? What? Yeah, and stuff like that, and confusion. And I got involved in sports and other activities and had some friends to get involved with, and that helped my mental health out quite a lot. I grew up in the 70s and 80s, when a lot of stuff out there to help children, like therapy and support groups, just weren't available. If they were, they were extremely few and far between. Um, so I lived my life as a straight heterosexual male, and had two significant relationships, and had my own biological children. And eventually realized that, hey, okay, I am transsexual. It's just no getting around it, through it, over it, or under it. And I needed to do something about it. And it was the right choice for me at the right time. I was an older adult, when I decided to start medical treatment. And yeah, maybe I could have started it as a younger adult. Um, and if I would have, I don't think I would have had some of the experiences that, I just, wow, and that have enhanced my life greatly. There were down times there too. My children are the best things that ever happened to me. They really are. If I'd done something earlier before they were born, I would have never had that opportunity to be able to have children. I got four children, and yes, one of them is adopted, and that is totally cool, because I believe that in my heart she is my child. She's a beautiful person. She's got her own daughter, and they're beautiful. They really are. I would have missed all of that had I started a transition before they were born. Um, Not all people that transition later in life have children. One of my friends they just helped out with her going with her surgery doesn't have any children, and that was by choice, and there's nothing wrong with that choice. It's totally acceptable. Um, and some of the other consequences that children that they have found with children on puberty blockers with like Lupron and stuff like that, other drugs like that. They've noticed some have had brain swelling and it's caused blindness, temporary to permanent blindness. Um, what's the plus with them? And I've only seen one, and this is for children who really do end up as being trans as an adult. Is that it does stop them from going through the puberty they should have gone through as when they were born, and like I said, I don't agree with that. Doing that because the other side effects are worse, far worse. And the suicide rate is all when after being put on puberty blockers has nearly doubled over those who are not put on puberty blockers. These are some of the things that some studies have found, and people just don't want to talk about it, don't want to accept it. And it's causing more harm to children than it is good. Um, and a lot of the things that people are getting information from is the W path, and the W path standards of care. Even though there are people in W path that have medical degrees, W path is not a scientific or medical organization. Um, And over the last couple of years, I think they've started to realize with a few people in WPath, kind of just stepping aside from there and talking about what they've seen when it comes to children. It's some of the harm that these drugs do to children. Um, with the harm that is causing children, I believe it should be considered a crime. Um, Knowing the irreversible side effects and damage that it does do to children, not to mention the elevated suicide, the elevated suicide rate. Transgender community. To me, that's unacceptable. It is. That's pretty. And mental health, absolutely, and not this affirmation therapy, and not this talking children out of it. Okay, well, the therapy I'm talking about is go with the child, take the child in, and go through a process that has the child look deep inside themselves, and figure some stuff out and have ways of maybe hopefully dealing with their gender questioning. Um, because it is tough. It is hard. None of it's easy, especially questioning gender. Um, and also, finding ways for things for children to do. because not just sports, other activities outside of sports. Um, have the children try things that maybe see if they can get them to try things that are um, geared for girls and geared for boys. It doesn't have to be the atypical, like for boys, the football or the wrestling or things like that. Um, Maybe baseball, softball, like girls softball, field hockey, boys rugby, soccer, boys and girls teams, um, and involved with stuff like that or activities that they can do at home. Um, and I know sometimes girls like knitting and stuff like that. And they like to do stuff with makeup. Maybe if boys are questioning their gender, and they can try something like that. Those things as well. And have the girls try boys things and girls things, and boys try girls things and boys things to do. Um, but yeah, and then get together with friends in free time and just have an adventure. Leave the technology alone and just have an adventure. Use the imagination. Um, and like I said, the real mental health therapy that has the therapist does those questions. Look, and a little pushback is okay. And I'm not talking about the pushback that talks to the enough. Okay, help better what's going on with. Like I said, for me, there was gender confusion, and I wish I would have been able to have the opportunity to have that kind of therapy in my life as a child. It would have definitely helped. Would have been a plus on top of the other things that I can do outside of the therapy with friends and activities. And I grew up in an era where we didn't have this technology, so it's like using the imagination was about all we had to do, finding things to do. And I grew up in what's considered a farm town. Um, and we'd get together and, kind of like weird forts or whatever, go have adventures in the woods, whatever. And I know inner cities kids don't have stuff like that. I'm sure there's things that they can come up with for an adventure, using the imagination. Because the more we use our imagination to do things, the more we can grow and understand ourselves. Um, Using a bunch of this stuff together, can really help the mental health. And I know there's some children that they're going through this gender questioning period, and have a serious depression and have say an anxiety and suicidal ideations. And there's treatments that can be that are through that antidepressants. And, if needed, it's I'm not by no means stating to give your children away to a facility. If they need some inpatient mental health help for a bit, say maybe up to a month, and it'll help them get through these stages so that the point where there's more. children, involved with their lives, talk to them about their likes, dislikes, what they're doing with their friends, and the more we get to know our children, the more we can help them out. And that's by having conversations like at the dinner table or on weekend vacations or week long vacations or whatever you may do vacations or not do vacations, or just time off to spend with the family. Um, it's it is a it is rough. It's rough for the children and it's rough for the parents. And I understand why parents would be scared of something bad happening to their children. With the mental health and mental stability, over gender questioning, and also let them stop mix and match of clothes and toys. Um, all the stuff that it's just ideas that could hopefully help children get through their puberty and questioning, and because it's when we start doing allowing them to do that and go through their puberty and just live as a mix of both. If you're a girl, live as a tomboy. Try living as a tomboy for a little while. Try doing girly things too, also. You know, um, and boys, do some boy things. And I don't want to say Tom girl things. How about Thelma girl things? No, for a lack of you know, for it to fit, I guess. Um, Thelma girl, or whatever girl name you want to put in there. It's just a name I picked out of the air. Nothing particular, no one particular in mind. And it's like, yeah, and they're so important. And antidepressants, if needed, anti-anxiety medications. It's we want to help our children be healthy. And if we're not giving them these puberty blockers, it's gonna ruin their system and completely stop their puberty development and the stages that they need to go through from the sex that they were born as. We're doing a more of a disservice than a service. Um, Gender questioning, absolutely, yeah. Trans, I'm not. I'm really not buying into the trans kids, the transgender, transsexual children thing. I'm really not. And especially minor children. And what's the appropriate age for allowing and starting transgender medications and transgender medical treatment for children and adults? Over the course of all 50 states, the legal age is considered of consent is 18. Um, Although there is one thing 17-year-olds can do if their parents sign for it, allow them to do that, is join the military. Okay. I'm 50-50 on that. And for when it comes to 17-year-olds starting medical treatment. And when I say kind of 50-50, is what's the emotional and mental stability of the person at that age. Um, if they seem to be reasonably with like the gender dysphoria, if they really have gender dysphoria, is their other mental health stable? You know, whether it be by therapy or prescription antidepressants, anxieties, and that all that, are they stable enough? So I'm like, okay, to say, okay, yeah, I understand what you're saying. I have an understanding of what you're saying and what you're telling me. Maybe not 100%, but I'm sure a lot better than 50%. A whole bunch better than 50% of following what you're saying and understanding what you're saying. Um, and that gets towards the age where, yeah, okay, they can make some kind of a reasonable decision based on where they're at that time. Um, and if they need more other further therapy and antidepressants and whatever to help get that the depression, anxiety, and whatever else is going on stabilized, then yeah, let them have that time. Um, and maybe explore short term puberty blockers at that time. Um, because like I say, if people can join the military at 17 with parental consent, then okay, yeah, and the parents should be involved with that decision as well as medical treatment for 17-year-olds. Um, and I know my kids when they were 17, on most everything, a lot of things, they they had some good reasoning skills. And if they didn't know about certain things, they were willing to learn about it. If it's something they thought they needed to know or wanted to do and know about or maybe do and didn't know much about it. And they always ask questions. You know, as I've had in my past, I've done a lot of different things, a lot of different things. Like at school, I played on the school teams starting in junior high school, high school. I played sports, male sports, and a bunch of friends and friends, boys and girls. We played um, like mixed softball. Uh, made up some mixed softball teams, and I played softball. Where boys and girls were on the same teams, and indoor soccer, stuff like that. Even volleyball, and boys volleyball, girls volleyball, mixed volleyball. Outside of the just friends getting together and doing volleyball for fun and having mixed volleyball teams. For something to do for fun, and it helped get practice. Um, in sports, scholastic sports, college sports. Um, I believe in college sports and professional sports, there's mixed leagues or adult mixed leagues for certain sports, and that's cool. And I think possibly in college, there may be, there may not be. I'm not too sure on that. Um, but yeah, it's definitely a difficult thing to have to deal with children being having possibly slim possibility of actually really being trans, and more that are not when they're allowed to go through puberty, because the puberty gets things going and develops, and they get an understanding by going through the development to adult maturation and start learning things about themselves, and they get a better understanding of who they are inside. Okay, and helping them understand what they're going through, or help them deal with what they're going through. Um, yeah, I'm not sure what more else to talk about, but yeah, it's just like I said. I don't necessarily, I really don't agree with, yeah, in the therapist's office, yep, you're trans. We're going to start you on medicalization in less than an hour or 2 hour or up to 2 hours, like two different treatments or five maybe. Yeah, we're going to give you the medication, um, and just agree with the child. Um, because if we're really honest about it, any of us about being a child and having confusion about things, we're gonna know our children are very similar. Because we haven't developed a decent amount of life's experiences and the physical and mental development that helps us understand ourselves and others better. And that's where we need to help our children to better understand themselves and get through what they're going through. Maybe certain things they'll end up having for the rest of their lives. Maybe it's like being treated for depression. That may be something they have to be medically treated for the rest of their lives, whether it be therapy or therapy and medications, or just medications for depression and or anxiety. Um, and I totally agree with that. It's anything that helps mental and emotional stability is always good, always a good thing. Um, as long as it's not the puberty blockers for a minor. I'm going to get that in. Just this is a disclaimer. As long as it's not puberty blockers. Um, but yeah, like I say, I talked about the harm that it's done and the research that's been done. Um, and I think the president of WPATH, Marcy Bowers, she's a transgender doctor and she performs trans surgeries and stuff like that. I don't know if it's rumored or rumors or whether it's actual fact, but she has supposedly come out saying that she's seen some of the harm that has happened with children in the course of her working with trans patients. Um, for instance, the big one that she helped deal with as a child is Jazz Jennings. Her story is kind of heartbreaking. Um, Multiple SRS, GRS, sex reassignment, and gender reassignment surgery, whichever one you'd like to call it. And, yeah, that ought to say something along with others that have come out from WPATH and noticed harms from puberty blockers and other things that are being medically used for children and children that are underage, under the age of 17, being surgically altered in the guise of transgender, transsexual medicine. Um, and finding out what we really need to be doing for children, because it's children that we need to be concerned with so they can grow up and find some sort of happiness and comfortability with themselves when it comes to gender and sex. Identity, yeah, sexual identity. Yeah, it's very difficult. Can be very difficult. Um, it's like one of my daughters is has chronic depression, and helping and watching her will go with her through that, and yeah, it's just being open to listen and talk, and hopefully help guide her to others that can help her out as well in the medical field, because she is so important to me. I want her to be happy, as happy as she can be. Have the depression under control. I think we all get depressed from time to time, whether it's chronic depression or depression from gender dysphoria or just going through life. Um, and reaching out for help is always a good thing. It's always a plus. So, anyway, I think I've rambled enough, and well, not rambled, but talked enough. 57 and a half minutes. So please, just, I hope you've all stayed for the whole thing and leave comments, concerns, and stuff like that. And yeah, so I'm gonna sign out and let you know. No matter what side of it, this you're on. Know that you're cared about, and you have worth, you have value, and you're important. You really are. Um, and our children are even more important. So yeah. So just know this: if no one has told you that they love you today, I love you. Thanks for tuning in. All of you have a great rest of your day, wherever you're at your day.